More than 750,000 doses of COVID-19 vaccines are now allocated to Wisconsin. Nearly 500,000 are ordered, 100,000 are on the way, and almost 250,000 doses have been administered.
Starting Monday, adults 65 and older can get the COVID-19 vaccine. They join frontline healthcare workers, people in long-term care facilities, and police and firefighters as people who are eligible to be vaccinated.
We have team coverage on what that means for you or your loved ones in this age group. Francisco Almenara is standing by with how vaccine administrators like hospitals are reacting to the news.
But first, we go to Capitol Bureau Chief AJ Bayapur, who has a rough timeline on what this will look like and guidance for who to contact. AJ?
The Department of Health Services says while the final list of who's in Phase 1B is yet to be complete, they know it will include people 65 and older because that group is far more likely to develop severe COVID infections. DHS is asking people for patience here, and this is why. There are about 700,000 people 65 and older in Wisconsin. The state is currently getting about 70,000 first doses per week. Now, the agency says it does anticipate it will get a first dose to everyone 65 and older within the next 2 months. At this moment, they're asking people to wait a couple days before calling their doctors or pharmacies to avoid overwhelming the system.
Honestly, if I was 65 today, I think I'd say, that's good. I know I'm going to get my vaccine before summer comes, and I would simply wait a few weeks and see as more information comes out.
Deputy Secretary Julie Willems Van Dyke says if you want to know more today, you should visit the website of your healthcare provider or pharmacy, wherever you would normally go to get your flu shot. Van Dyke says she talked this morning to the general overseeing vaccine distribution for the entire U.S. She says his message was that Wisconsin should have a stable supply of the vaccine for the next 3 to 4 weeks, somewhere in that range of about 70,000 doses coming in per week.
All right, AJ, thank you. Even though the vaccination has been opened up to more people, hospitals are still asking you to be patient when it's your turn.
Francisco Almenara has got you covered on how Madison area hospitals say vaccinations are going to work with this part of Phase 1B.
Area hospitals have learned how to streamline the process of administering the coronavirus vaccine with their staff. Starting Monday, people over 65 will be able to start getting vaccinated too.
We are working busily right now, finalizing our plans to expand our vaccinating process to our patients.
David Childers, Vice President of Clinic Operations at Unity Point Health Meriter, says roughly 6,300 of their patients are in that over 65 Phase 1B group. He's urging people not to call in to schedule an appointment. Hospital staff will reach out to them.
We'll be utilizing all of the avenues that we have to contact our patients, including phone, email, direct mail, and our electronic patient portal called My Unity Point.
Like Unity Point Health Meriter, UW Health will also be reaching out to patients through the MyChart system. However, they will also be allowing patients to sign up for a wait list, but that's only for very specific use cases.
Now, this is for people who are flexible enough to be able to get a vaccine on a very short notice, in the order of a couple of hours. So once we realize we're going to have an extra dose, we'll work that wait list, looking for people who can, get to a vaccination site in very short order to get that dose.
Dr. Jeff Potoff with UW Health says that situation will be rare. For the most part, both hospitals ask for patience, as it will be a long process to get everyone vaccinated.
We're just trying to devote a lot of our resources to working through that list. But even with a lot of resources devoted to it, it's going to take a little bit of time to work through, that many names.
In Madison, Francisco Almenara, 27 News.
SSM Health also tells 27 News they'll be reaching out to patients through their online portal in phases. Hospitals are still evaluating the best way to decide who gets the vaccination priority, either by random choice or analyzing each patient's specific situation.